मैडम आपका नाम क्या है? क्या तकलीफ लेके सर के पास आई थी?
मेरा सीना में गिल्टी हुआ था, इतना बड़ा था, बहुत छोटा हो गया है।
ब्रेस्ट का?
हाँ,
ब्रेस्ट का, लेफ्ट ब्रेस्ट में
हाँ,
गिल्टी था।
हाँ।
কত দিন ধরে?
कितना दिन से दवा ले रहे?
6 महीने से।
2-3 बार आके दवा लिया है, मगर अभी छोटा हो गया।
बहुत छोटा हो गया।
हाँ।
पहले 3 पॉइंट था, क्या बोलते 1.35% हुआ।
হ্যাঁ, আমরা এখানে ডেট অনুযায়ী দেখছি যে ওনার প্রথমবার ইউএসজি রিপোর্ট যেটা দেখাচ্ছে 3.808 ইন্টু 1.48 ছিল, কিন্তু এখনকার রিপোর্ট যেটা দেখাচ্ছে সেটা অনেকটাই কমে গেছে।
প্লাস ক্লিনিক্যালিও আমরা দেখলাম,
হ্যাঁ, সেটা 1.8 ইন্টু 1.35 কমে গেছে। স্যার আপনি এবার বলুন যে ওনার এই গ্রোথটা নিয়ে এসেছিলেন।
এটা প্রথমেই সোনোগ্রাফি করা হয়েছিল, অনেক দিন ধরে গ্রোথটা ছিল। এইগুলো আজকাল খুব কনফিউজিং, বিশেষ করে আমাদের কাছে, পেশেন্টের কাছেও খুব কনফিউজিং। দে হোয়াট টু ডু, very difficult to judge this type of big nodule. In the future it may be turned into very bad diseases, towards bad diseases. So sometimes we do FNAC, but here the SOL was very big. It was more 0.4 centimeter and 1.8 something centimeter, and after taking the medicine, gradually it became less and less. Now after that is becoming less from 3 to 4 months. Now it has become less, so it is a very good sign. And this was a case of possibly fibroadenoma, but medicine should be continued to check the recurrence. That is a very good sign. And also clinically it has been shown that the growth is very less. Also the patient আরেকবার জিজ্ঞেস করো, বলে যে আপনার কি মনে হচ্ছে অনেকটা কমে গেছে?
आपका लग रहा है कि थोड़ा कम हुआ है?
হ্যাঁ, বহুত কম हो गया।
बहुत कम।
তুমি যে দেখেছো সেটাও বলে দাও।
হ্যাঁ, আমিও ওনার ফিজিক্যালি ওনাকে চেক করেছিলাম প্রথমবার যখন এসেছিলেন। বেশ হাতে অনেকটা বড় লাগছিল এবং এখন অনেকটা ছোট হয়ে গেছে, যেটা আমি ওনাকে চেক করে বুঝলাম।
এইবারে মেডিসিন যেটা দিয়েছিলাম, যেটা বলার জন্য হোয়াট মেডিসিন আই গেভ, দ্যাট ইজ দ্য নেট্রামিউর 201 dose. That was given 5 to 4 months ago. After that, all the repetition was not there, and gradually it is becoming less and less. After few months, that will be disappear. The main thing, I have selected the medicine. Oh, there was some anemia that has also been cured. The hemoglobin was more or less 9. Now it is towards 11.5 or something. The same medicine increased the absorption of iron from the body, and the anemia has been also better. Very prompt action, both the things better. So I have taken the medicine from the very beginning, that if she is very much under grief, he don't exposes the grief. That is the grief silent, and very sensitive from the very childhood, sensitive to noise. He wants to keep things in a very good manner, fastidious, and most of the time she wants to be alone, wants to stay alone. That is company 𝐬𝐭 𝐷𝐿𝐻, company 𝐬𝐭. Then she loves affection, very much affection. That has been coming after questioning several times from the very childhood. That is the main thing. Now in the childhood the grief was silent, but now she is begun to protest. History of weeping alone and reserved do not want to tell anything and always wants to keep the mind. And last is the sadness, dwelling constantly on her condition. She was very much sad and always she thought that she is suffering from very gross diseases, what will be the condition in the future. So collecting all the symptoms, the medicine is Natmur 200. So here again we want to say that the mental symptoms is very important. Along with the mental symptom, there are many physical symptoms of Natmur, that is the craving for salt, but the patient has got craving for sweets. There is no history of headache in the Sani. There is no consolation aggravation. That is on the other hand, consolation better. So you have to judge the interior of the man, the soul of the man. That is why Natmur came and the patient will be cured totally within few months. Thank you.